Start.
Hello,
Hello.
this is Dr. Gabriel, doctor in the medical clinic. Are you Mr. Donald Trump, 67-year-old?
Yes, doctor, I am.
Well, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we start, can I know how much you know about your condition?
Doctor, yesterday I suddenly developed some shakiness of my hands, and after that I was so worried and I fell down. After that, my daughter brought me to the hospital, and after giving some treatment to me, I am feeling fine. And apart from that, I had cancer in my lung. For that, I have been receiving chemotherapy, and the doctor said that I am doing fine with the chemotherapy.
And I'm sorry about to hear that, Mr. Donald. And can I know how you doing now?
I am fine, doctor. After giving the medication to me, giving some oxygen, I am feeling well, totally well, doctor, and I think I can go home now.
And Mr. Donald, do you have any expectation for our meeting today?
Doctor, one thing that why did I develop this symptom?
Mr. Donald, the treating team were after you came yesterday with this symptom, did for you multiple imaging and investigation. And I'm sorry to tell that, but the imaging for your brain and your investigation showed spreading of your lung cancer to the brain, which call metastasis to the brain.
What do you mean by
Are
that,
you with
doctor?
me, Mr. Donald?
I was taking the treatment for the my cancer in my lung, and even it has went to my brain. Is it possible?
I'm sorry to tell you that, Mr. Donald, but even with during the treatment of the cancer and even with the best treatment available, there is still possibility for the cancer to spread through the body to multiple system like brain or liver or anywhere else. And this is the case in your condition. I'm sorry to deliver this bad news for you.
Okay, and so that I develop this symptom, you suspect that I develops this shakiness for my brain tumor.
Yes, I'm sorry, Mr. Donald, but this is the most probable explanation for your symptom that there is uh, cancer spread to your brain that causing damage to your brain cell and causing your symptom of your shaking of your hand.
Doctor, so I am totally fine now, doctor. I am totally okay, and even if it is my cancer in my brain that went from my lung, my cancer doctor previously said that I am well with my medication, so it means that I will be fine after completing this medication, right?
Mr. Donald, I appreciate your concern. You will be after this event happen, you will be refer again to the treating team. They will study, investigate further, and they will stage you again, and they will meet you again and set with you the plan of treatment. Maybe they will continue with you with the same treatment. Maybe there is some treatment, new treatment available for your new condition. Did
Will
you
it
get me,
be
Mr.
all right,
Donald?
doctor? Again?
Sorry?
Will I be again all right?
I cannot guarantee you, Mr. Donald, but there is treatment available. Though the spreading of the cancer to your brain adding further deterioration of your condition, but still there is treatment available the
What
team
what do you mean by doctor?
will
This
offer
I,
you
I, I cannot take your talkings, doctor. I was fine with my lung cancer and then I took all the treatment available and I always followed the doctor's advice and even I have this cancer again. And you are saying that I
I'm
am going to die.
I'm so sorry to deliver this bad information to you, and I can understand the situation you are suffering now, but in your condition, this even with the best treatment, there is still possibility for the cancer to spread. I'm sorry to tell you that, but still, the team managing you, they will see if any treatment available to
Time
treat
up.
you further.
So what was your task? Do you hear me? Hello?
Yes, I'm with you.
Okay, what was your task?
My task to explain to Mr. Donald the new condition, the metastasis to the brain from the origin cancer in the lung.
And what do you think?
And
Have you been able to explain this to him?
I tried my best to explain the new condition and the further deterioration of the original disease.
Okay, and patient asked that why he has developed this symptom. I think you didn't give the answer directly.
The, the reason in my mind that even with the best treatment, there is still possibility for metastasis.
Okay. Patient uh, question was why I have developed this symptom, that is seizure.
Yes, this
What
seizure
was
of
your
the
answer for that?
it was not clear. I should clarify further by the explaining in details that the symptom you're having by shaking your hand because of a new uh, metastasis spread to your brain and causing the neurological symptom.
Yes, I was expecting that. Otherwise, you have done extremely fine. I was expecting that you would at least say that my symptom was due to uh, tumor in the brain. We are suspecting that. Okay.
I suspect or confirm. We confirm that your symptom due to
You can say confirm or you are suspecting that this is probably due to that metastasis. I think you should say the suspect because this will give you the 50% chance of that is called running from your position. Okay, and otherwise you have done extremely well.
thank,
Whenever a patient asks a question, try to give the direct answer. When you don't know, say I don't know,
thank you.
or I don't know at this moment. I cannot give you the answer, but I will inform you uh,
This
after
was because of
discussing this condition with the person.
misunderstanding of the question. I understand the question by why I have the relapse even with the
No, patient was
treatment.
asking that why did I develop this symptom, that is seizure.
Yeah, but I
You
got
could,
the
okay,
question.
whenever you cannot get the question, always ask. Okay, that is not your fault that you couldn't get or you couldn't understand. But giving a wrong information or giving another explanation, that is the wrong thing. You can always ask that. Okay. Can you tell me more about your concern, or can you please tell me more about what is your concern? Can you tell me a little bit more about your question, that what do you want to know?
Mm-mm.
Okay.
Okay.
So we are going for the next case, right?
Okay.
Start.
Hello.
Hello.
This is Dr. Gabriel, doctor in the medical clinic. Are you the daughter of Mr. Donald Trump, 67-year-old?
Yes, doctor, I am. I am really worried about my father's condition, doctor. So I wanted to talk with you. Actually, my father, you know that my father has cancer for a long time, and he's on treatment for that also. And suddenly, yesterday, he developed some shakiness of his hands. So he was brought to the hospital. And till then, doctor, he is unconscious. So I am really worried, doctor. What is happening with him? Can you tell me that why he is in this situation? I'm really worried, doctor.
I'm sorry. I'm so sorry about this stressful condition you are within. How can I address you,
Call me
Miss
Miss Rose,
Tom?
doctor.
I'm so sorry, Miss Rose, but do you have any expectation what explaining this deterioration in your father condition?
Doctor, my father also had some shortness of breath previously, and he needed some ICU support. That you tell that ICU support. But this time he is also unconscious. So why aren't you giving him the ICU support? And you know that his condition is very poorly. He has cancer, and he is a aged person. Why aren't you going for that, doctor? I'm really worried for that.
I appreciate your concern, Miss Rose. As you said rightly, your father condition so deteriorating, and he is now in a really serious condition. As the background of your father that he has the lung cancer, and the further deterioration today was investigated by the treating team, and they found that there is spreading of his lung cancer to his brain, causing his symptom of decreased level of conscious and the deterioration he is having now. Are you with me, Miss
Okay, doctor, we can
Rose?
understand, but why aren't you giving any treatment to him? He is on the
So
ward till admission. Why are you going for that, doctor?
I appreciate your concern, Miss Rose. The treating team found that he is so in advanced condition, and at this stage, there is no treatment uh, can cure his condition.
What do you
So
mean
the
by
best
so you are not going to give him any treatment?
there is treatment available, Miss Rose. The best treatment for him now, as decided by treating team, is the palliative care. Have you ever heard about the palliative care?
No, doctor. So that are you going to that he is not improving? So you are going to give him some medication so that he can die soon. Are you going for that?
No, Miss Rose. Do you want me to explain to you the palliative care
Okay, doctor.
management? It is a type of management in which there is he will be under care of multiple specialty team, including the cancer doctor, the cancer specialized nurse calling Macmillan nurse, and the pain management team, and specialized nurse and specialized nutrition. They will treat all his symptoms so he will not feel any suffering or any pain during his uh, this condition.
So what are you
As
thinking, doctor? Is he going to die?
I'm so sorry to tell you, Miss Rose, but his condition is so advanced and making his life shortened than other, and no treatment can cure his condition or make his condition reversible.
Oh, doctor, I'm so much. disappointed after hearing this, but he responded well before after sending him to the ICU.
I'm so sorry to tell you, but at this stage, because of the spreading of cancer to his brain and the further deterioration in his cancer condition, so the doctor treating him doesn't expected that he will improve further, even with the all treatment available.
1 minute remaining.
So in case Mr. Donald deteriorate further or he need for intensive care admission or if his breathing stop, we will not go further for intervention like introducing the breathing tube to his breathing pipe. Are you with me, Miss Rose? Because
Yes,
this
doctor.
will not improve his
Is it
condition.
because he is very poorly and he's unconscious, so you're not giving him any treatment? Is it
Sure,
that?
no, Ms. Rose, but this treatment offer for some patient who can improve and so will provide the artificial breathing temporarily until his underlying condition improve and he will come back. But
I'm
this
up.
not the case for further condition.
Okay. So what was your task?
I tasked to explain to Miss Rose, the daughter of Mr. Donald, the deterioration in his condition and the decision of the treating team by giving him the palliative treatment and not to give him invasive management.
And what was the scenario?
The scenario was to explain the Mr. Donald condition and deterioration and to explain the management plan.
Okay. And what do you think? Have you been able to explain this to his daughter?
I try my best to explain the plan of management, but maybe I don't have the time to explain every detail.
Okay. You have explained everything well. That was fine.
Thank you.
Okay. For this case, I don't have much thing to tell you. That you have confirmed the she's Donald Trump's daughter. She was at a flow, and at that time, I think it was unnecessary to know her name. You could ask it at earlier. She was going to express her feeling, and at that time, you asked her name. So it was somewhat odd.
Because I didn't have the chance to ask her name at the beginning, and I need to. How can I call her during the conversation? That I can call her like Mrs. Trump.
No, no, no. You cannot call her Mrs. Trump. Mrs. Trump is Mr. Donald Trump's wife. You can call Miss, or you could ask at the beginning of conversation. Okay.
Hmm,
And
yes.
patient's daughter was going to express her feeling that her father is at a very bad stage. So at that time, somewhat just asking her name will reduce her flow. She will take time again to begin the flow, and you will lose your time. So that I'm telling it. Okay.
Mm-mm.
Okay. So I am sending your next page. Okay. Start.
Hello,
Hello.
this is Dr. Gabriel, doctor in the medical clinic. Are you daughter of Mr. Donald Trump, 67-year
Yes,
old?
doctor. Yes, I am.
And how can I address you?
Please call me Miss Rose.
Rose, Ms. Rose, we are here today to discuss your father condition and what we can do further. Is that okay with you?
Okay, okay, doctor. I am just worried about my father's condition.
So can I know how much you know about your father condition?
Doctor, you know that he has cancer in his lung, so that, and he was getting treatment, and suddenly he was developing some shakiness of his hands, and he was brought to the hospital. And till then, he is not responding to anything. His condition is deteriorating, I think, and he even cannot get any response from us. We are calling him, we are touching him, but he cannot appreciate anything. What is happening with him, doctor?
I'm so sorry, Miss Rose, but really your father condition is deteriorating fast, and the treating team should assess your father condition, and they revealed that he doesn't show any improvement by all treatment he's receiving.
What are you going to do with him now, doctor? Cannot you give him anything that can improve his condition?
So, Miss Rose, after uh, detailed assessment of your father condition, and after multiple trial by multiple line of management, but your father doesn't show any improvement in his condition. Rather than that, he showed more deterioration. So the treating team feel that your father deteriorating fast, and they expect uh, that he will have this condition will shorten his life.
What do you mean by doctor? He's going to die.
I'm sorry to tell you, Miss Rose, but the treating team feel that maybe your father will have days rather than weeks.
Oh, doctor, I'm so sad hearing this. Cannot you do anything for him? I think he is in pain. He was developing some shakiness. Cannot you do anything for him?
I'm so sorry for your suffering, Miss Rose, and I can understand the condition you are feeling now. But the team do everything he can for your father, but he doesn't show any improvement.
What are you
So
going to do now, doctor?
what we can do now that we will give him the care that uh, release his suffering, and to remove all the trial of management that increase his suffering rather than improve his condition.
What do
And
you mean,
we
doctor?
will
You are not going to give him any medication, and you are going
at
to stop
this
all the medications. That is just you are going to kill him.
I appreciate your concern, Miss Rose, but at this stage, given a medication that increase his suffering rather than giving him a cure, it is not the proper management. The best way to manage him at this stage to give him relief of his symptom and to reduce the suffering from him and to give him ease in his life in his last days.
Okay, doctor. So why are you saying that you are going to stop all the medications? You should give him more medication so that he can be fine.
Mm, I appreciate your concern, Miss Rose, but the medication we are giving now, it will not give any more benefit to him. It will give suffer rather than giving him a cure, as he reach a stage that not able to be cured.
1 minute remaining.
For that, we will not give him any medication that will not give him any more benefit, and we will take care uh, for him to be safe in his last days of his life.
So that you are meaning that you are going to slowly kill him.
The, no, Miss, don't misunderstand us. It is a type of treatment that it is proper for him at this stage.
It doesn't mean that you are going to kill him because you are not going to give him any medication. But he will die.
Sure not. Sure not, Miss Rose. He reached the stage that no treatment can cure him, and
Time up. Okay, so what was your task?
I tasked to explain the deterioration in Mr. Donald Trump condition, and that no medication can cure him at this stage, and the plan of treatment to care for him at the end of life care.
Okay, so what do you mean by the end of life care?
That to not giving him unnecessarily treatment or procedure that increase and prolong his suffering rather than curing him, and to give him the management only that ease his suffering at the last days of his life.
Okay, so you're giving going to give this patient industries life care, right?
Yes,
By withholding
yes,
some medications.
yes.
And do you think that you could have explained this thing to the daughter in a very proper way or in a very good way?
I try my best. I think she understand the condition.
I don't think that she understood you properly. Okay, and have you ever heard that term euthanasia?
Uh, I I don't hear of this.
Okay, do you know difference between the industries life care or euthanasia?
What is the spelling? This one?
EUTHANASIA.
I don't know anything about it.
Okay, actually, industries life care meaning that the patient is going to die, and no medication in this world will uh, give him any thing that will any medication will in the world that will improve his condition. So he will die, certainly die. So that you are giving, you are withholding some medication that is not giving him any benefit. Rather, you are going to give him some medication that can relieve our symptoms, like for any pain, you can give some morphine. For any respiratory distress, you can give some morphine. And for bleeding, you can conceal the bleeding with some uh, red blanket or like that. Okay, that means you are giving in distress like that. And euthanasia means that the patient, and also in industries like care, this is a passive thing. You are not actively killing him. You are passive thing that you are withholding the medications that is going to prolong his suffering. And in euthanasia, that means that you are, suppose a person is a terminal cancer patient, he has so much suffering, so much pain, so much depression, so much what is called pain, depression, so much dysphoria that he cannot even tolerate himself. So at that stage, he decided to uh, that is called one type of suicide, that he decided that he will kill himself, and he cannot kill himself. The medical person can give him some medication, something, some overdose medication, like giving him some morphine
Morphine.
that will
This
give him relief of
in
his pain.
Arabic term القتل الرحيم.
So
يعني
that you are that cases you are actively killing him. That is
م-
called euthanasia. Eu means good, thanasia means death. That is means you are giving him a good death, because he will not improve his condition. He is a terminal stage. He is suffering so much, so that you are giving him the what is called, you are killing him. That is euthanasia. And in this life care, it is legal, but euthanasia is illegal in most of the countries. Okay,
م-
so you cannot, you are not giving him the euthanasia. So I was explaining this two thing. And when you are discussing a thing of, suppose in this type care, you should say patient that you are not going for that type of treatment that is going to kill him. Rather, you are going to give him the medication and or withhold